call us into the business office and they're like, they're not approved. So you're going to have to sign a waiver. And the price is 5,500 per scan. They denied everything. They denied after chemo, they want to give him a shot to boost his white cells. Well, you need prior auth. That's going to take 72 hours. Well, in 72 hours, he's either going to be in the hospital or he's going to be fine. Not everybody is aware that this is happening every day, all day to everyone.
Yeah. I mean, there needs to be the ability
Right.
to have malpractice suits at the very least, and, at the very most, even criminal repercussions, because it really is indirectly murdering people and psychologically torturing people.
So they're not even looking at your chart. This is AI denials. So
Ridiculous.
doctor's not even opening the chart, looking at it. It's just deny, 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 deny. This oncologist decided, like, he knew he got the chemo,
Yeah.
decided it wasn't medically indicated, and rejected the claim is $80,000.
Hello, and welcome back to the Chronically Courageous. Thank you for being here. I have a really special episode for you today. We are going to talk about the problematic health insurance industry, and I have a very, very special guest with me today whose life was profoundly affected by the issues with health insurance. She's not only a friend of the family, but her husband, Dan Hurley, was one of my many doctors and actually the first ENT to ever perform a myringotomy on me, which, for those who don't know, is the ear tube surgery. I've since had about 10 more, but he was my first wonderful doctor. And my guest, Traci, is a board certified MD herself with over 20 years of experience as a pediatrician. She's also a mother of three children. And this is the part I don't like to say, but as of August of 2023, she tragically became a widow when her best friend, the father of her children, and her husband of 25 years, Dan Hurley, lost his battle with a rare type of bone cancer called chondrosarcoma. Did I say it right?
Yep.
Oh, good. Okay. I was hoping I would. Since Dan's passing in August of 2023, Traci has become a prior authorization advocate working toward health insurance reform. Her efforts are a continuation of the mission that her husband Dan had developed a passion for in his final years, because he himself experienced quite a battle with health insurance denying certain tests and coverage for his own care while fighting for his life, which is egregious. And we'll definitely get much more into that side of things. But I kind of want to just hear from you, Traci. How are you doing? Like, I mean, it's kind of a weird question given everything you've been through, but
Yeah. Yeah. I never know how to answer that question. I just have to take things one day at a time still. I'm still in that phase where I'm still very numb from everything that has happened. I was explaining that, pretty much the moment that Dan died, it was like a flip switched in my brain or switch flipped.
switch flipped. Yeah.
And I've just been very numb. I don't feel much of anything, and I've had a lack of focus, which is very unusual for me, and I'm in pretty much a fog still, which I've learned to understand is my brain protecting me from the trauma that I experienced with everything that happened with Dan. But I spent a year working on my grief. I was in three different support groups.
Mm.
I did grief counseling. I just really took an entire year and just walked a lot, just trying to process everything and figure out my life. So it's hard to say. I mean, I don't know that I would say I am better,
Yeah.
but I'm surviving.
Understandable for
Yeah.
sure. And I'm glad you took that time to, really work on it, because that's so important. And of course, there's only so much you can do, right? To process the grief, all the therapy in the world and journaling and whatever other, modalities you use. I mean, it's going to be with you, and it's going to ebb and flow over time. There'll be periods when it's easier and periods when it's harder. And
Yeah.
I'm just really sorry that we even have to be having this conversation. Dan was only 50, right, when he passed, which
Yeah.
is, 3 years younger than I am right now. It's just, it's crazy to think about. Ugh. So in the chronic illness community, a lot of people are confronted with grief on a lot of different levels. I mean, there's the loss of life, there's the loss of of work, the loss of relationships, the ability to walk and do things and be independent, all these things. And many of these things are things that I've grieved and continue to grieve in my life as someone that has so recently been going through this grieving process. Do you have any words of wisdom you can share with others that are going through it?
Yes, I mean, I think that surrounding yourself with people who understand, has been very helpful for me. If anything at all has helped me, I think that that is it. There are a lot of people who don't understand and who try to make you feel better by giving you platitudes that make you feel worse. And I think that just being around people who do get it provides some comfort, and so I do recommend I was never one that would have thought I would go to a support group like that. I'm a pretty private person, pretty quiet, reserved, so the first day I walked into a support group, and I pretty much feel like I went mostly so that the kids knew that it was okay to get help and they saw me doing it,
Yeah.
that maybe if they felt like they needed to, they could, and I was terrified walking into that room, and I didn't hate it. Like, I was like, I was surprised I didn't hate it, and I know there are people who feel when they're in support groups like that, that, "Oh, I don't know, I can't take on other people's pain, and it's very difficult," and I have never felt that way. I have felt like I've been able to, have my story resonate with many of theirs, and it's validating, and just to be, like, understood.
Yeah.
And not realize, everybody says, "Oh, people think you're crazy." Like the thoughts that you have and how you feel is different from anything you've ever experienced before. And to know that, you're not alone in that is very helpful. So that's my word of advice. And I always felt like in order to move forward, like maybe you actually need to move. So that was another thing that I just committed to was like, I was going to move. However, that is, I'm going to walk, I'm going to work out, I'm going to get on the Peloton, whatever it is.
Yeah.
So I did a lot of movement as well, and those are really honestly the the only 2 things that I consistently did.
Yeah. No, that's good though. I can relate to the movement piece of it. I mean, it's my sanity. You know,
Yeah.
it really, I mean, it just puts your brain in a completely different place. You know, you can go into the gym or walk out walking. I do a lot of like walking in nature also, and it's just so therapeutic and healing. And it just kind of does give you that time to process and think. As a matter of fact, when I was preparing for this conversation, I kind of wrote out some notes while I was on the treadmill, which my fiance said, "Boy, that doesn't seem very safe, Bonnie." I'm like, "Well, I was just walking slowly. I wasn't like, I mean, I don't run because I can't run, but
Yeah.
I mean, it just really helps you to kind of it helps me to think more clearly for sure."
Yeah.
And yeah, and the support. I mean, and it is so important when you're grieving. And again, I can relate to this on not obviously, I'm not putting myself in your shoes.
Sure.
I can't imagine what you've been through. It's horrible. And oh my gosh, I have to mention the platitude thing. Oh my goodness, that
Yeah.
is something that so many of us in the chronic illness community deal with all the time. And I
Yeah.
used to be one that used them, and I'm embarrassed about it.
Yeah.
But I went through my like toxic positivity phase, like everything's gonna be fine and God doesn't give you more than you can handle. And it's it's all how you look at it, and you decide, blah blah blah. It's
Yeah.
like, I mean, to some there's a degree of truth in those things, but like that's not what people need to hear. It's not helpful at all.
Right.
It's harmful. So
And it's almost like, well, if the grieving person says it, then, it's I guess a safe place to go. But, things like, oh, he's in a better place, or, oh, God had a plan. Like,
ugh,
do not tell me that.
no. Yeah,
So
I do
like
not like this plan, and
yeah,
yeah, and I do
yeah.
not want to think that that's what God had planned. Yeah.
But if the grieving person feels that, well, that's something totally different.
Mhm.
Um,
Well, and it's also, I think a lot of times we act as though, like, we believe those things to make other people feel more comfortable. And I also think, and I've seen this firsthand, people say those things because they're not comfortable sitting with you in your own grief.
yes,
So, yeah,
absolutely.
it's a relief for them to be like, "Okay, well, if they're okay, then I can be more okay." You know?
And to your point, I mean, we've all said those things
Yeah,
because we didn't
yeah,
know any better, and
exactly.
now we do. So
And
don't be embarrassed about it, you know?
yeah,
Yeah.
if there is a gift in this, which I don't like to say it is because it's horrible and I would never wish any of these things on anybody,
Yeah.
but it is that understanding of, being able to relate to other people that have been in a similar place and really like understand it at a very deep level, like the people in your support group, because no one can get it unless they've been in that same situation. Yeah, I wanna talk more about Dan, and I want people to know more about who he was, and when when people are healthy, you go to a party and the first thing they say is, "What do you do?" They never ask, like, "Who are you?" And to me, one thing I've realized, I used to be defined by what I did, and my career was such an important part of who I was, and it was, I kinda led with that, and I think so many people do, but once you strip away your health and you don't have that ability to work anymore, then it's like, okay, well, like, what do you do? I mean, I tell people I'm on disability and then just everyone feels uncomfortable.
Yeah.
But I think it's more important to say, who are you? So who, from your perspective, someone that knew Dan probably better than anybody in the world, who was Dan?
Yeah. Um, I always have to be careful with this because when I talk about Dan, it makes it sound like when people pass away, you try to like put him up on a pedestal and
Yeah.
people are like, "Oh, she's acting like he was a saint." But honestly, what I say is all true. I'm not exaggerating. I mean, he was such a good person. Um, he was a wonderful guy who was incredibly smart, knew something about everything, was a voracious reader on any topic from salt. He would be reading a book about salt. And I'm like, what? Why are you reading that? He's like, oh, you wouldn't like this book, but it's
Just
really good.
curious. Yeah.
Yeah. To, medical things, to how to, he was very interested in processes that can make organizations better. So like his company, he was really wanting to make it run in a way that was better. And so that was like, I think his ideal goal was, yes, he was a doctor and he liked what he did, but ideally, I think he would have wanted in his later practicing years to scale back the practice and, come into medical practices and figure out what was wrong and fix them. And that was really like an interest of his. He was very interested in that. He was a lifelong learner. He always wanted to learn more about anything and everything. He was extremely funny, and he had a very dry sense of humor, so it was lost on a lot of people, which made it
Right.
even more
They didn't
funny,
always get
honestly.
it right.
Yeah,
Uh-huh.
it made it even more funny, and I mean, half the time I didn't know if you. I'm like, yeah, are you like, did that really happen, or are you making that up? And he always kept you on your toes, and the kids as well. He was a fantastic father. He adored our kids. They were everything to him, and he just, um, would leave work early. He wouldn't miss a single game that our kids had. They played sports and, like, he just lived for that. Like, their basketball games were so important to him and so fun, and he loved the club basketball scene and the traveling with them and was just really, really into that, and going to watch football games with my youngest daughter and, helping them with homework, assignments, life, essentially. He was of the two of us, he was the logical one and maybe like the long game kind of guy. I was the one they would come to for, help with this report or can you edit this paper that I wrote or
The
whatever
day-to-day stuff.
day to day. And but
Right.
he was the bigger plan guy. So and he was very generous, just a generous person, a great story. He loved to go to Las Vegas. He loved to gamble. But it was very measured. Like
Yeah.
once a year we went to Vegas and he would gamble. And we were in an Uber and the Uber driver was talking and said, "Oh, I have an 8-year-old son." And he's like, "Oh, does your son have a rocket?" And the guy's like, "No." And he's like, "What's your address?" And he goes online and he orders a rocket and sends it to the guy's
Oh,
kid so that his kid could,
oh,
because our son loved like these rockets
so
and we'd take to
sweet.
the park and launch. And
Yeah.
I mean, and that's just, a very small snippet of his
But it
generosity.
speaks to who he was. I mean, not, most people don't even necessarily speak to the Uber driver or ask what their name is, no less, you know,
Yeah.
go that extra mile to, learn about their family and then actually do something for their families.
Yeah.
My fiance is actually very much like that
Is
too.
he?
He
Yeah,
is.
super
He is.
sweet.
It's so sweet. Yeah.
Yeah, very generous guy. And just always did what he thought was the right thing. I'm not going to say he always did the right thing, but he always did what he thought was right. It was just an incredibly, I don't know, ethical, trustworthy person. There was never even a second where I would doubt his loyalty, his trust,
His
anything like that.
intentions
Yeah.
sounds like, yeah,
Yeah.
good intentions always.
Yeah.
Yeah. That's awesome.
Yeah.
Wow. You
Yeah.
got
He
it.
was a
You
good
got a good
guy.
one there.
I did.
Yeah. You got to I'm glad you had 25 years together. I wish you could have had, like 80.
Exactly. Yeah. Yeah.
Yeah. Let's talk about Dan's diagnosis. So, tell me about like how he first knew something was wrong, kind of, how the whole thing started and how it went.
Yeah. So he started having some hip or back, we weren't sure which, tightness. And he was an avid hiker. I mean, he would go hike camelback and he would hike over and back camelback. So I mean,
Wow.
he loved the Peloton, would ride on the Peloton pretty intensely. So just figured like I'm getting old, I got to stretch.
Right. Right.
So he started doing like stretches and like yoga holds and stuff like that, and it wasn't getting better.
Mm,
And of course, doctors make the worst patients, right? So he, or maybe was even in denial a little bit, but I was the nagging wife who was like, "You probably should go get that checked." He's like, "No, no, it's fine. Yeah, no, no, no." To the point where he's like, I'll take care of this." And he finally decided to go to physical therapy. Like, so
okay.
that's where he was going to start. And so he went to physical therapy and he's like, "I think I'm getting better."
Mhm.
And I said, I don't think you are." And he said, "Well, but you don't know what I'm feeling." And I'm like, "You know what? Right. I don't.
Right.
But I only know what I see and I don't see it." And he's like, "No, no, no. When I'm there, I'm like, I notice I'm getting better." I mean, what can you say to that?
Yeah.
Except,
He probably wanted to believe he was getting
yeah. So
better.
I'm like,
The
okay.
placebo effect is real too. So, yeah.
Yeah. Yeah,
Hmm.
it is. And there was even a little interchange with him and the physical therapist. Like, "Do you think I need imaging?" And he's like, "Nah," which we know
Mm,
better, right?
right.
Um, anyway, so one day our son's orthopedic surgeon's wife was seeing Dan and she's like, "You're limping.
Mm,
You need to text my husband."
yeah.
So he listened.
Good.
I'm like, "That's what
Yes.
it took." Like, I've been bugging you, bugging you, bugging you. But
Right.
so yeah, and so funny story. So he texts him right away. He's like, "Come to my office." He took an X-ray. They didn't see anything on the X-ray. He's like, "Yep, X-ray looks okay." And
Mhm.
Dan's words to him, and
MRI
this
is a
is
different story
true.
or a CT scan, yeah.
Yeah, Dan's words were, "So I can tell Tracy I don't have a giant tumor." That's what he said to him. And he said, "Well, wait a minute. There's something hindering the movement of your hip when I on your
Mm,
exam, so we need to get an MRI."
yeah.
Exactly.
Yep.
So got the result of the MRI, and um radiologist pretty much called it. He thought it looked like a chondrosarcoma. Obviously, you don't know for sure until you have a biopsy result, but
Right.
we pretty much knew then
Yeah.
that that's what it was going to be.
Yeah.
Yeah.
Wow. Oh my gosh. Yeah, it's funny how, like, the whole advocating for yourself thing is so, so important. And I've had many situations where they've done very preliminary imaging, like an x-ray, and they say, oh, you're fine. No, it's just a strain. And like this story I've told so many different times, but it's just a good example of a case where it's really important to advocate for yourself is, I wound up back in the ER the next day and my right arm was completely paralyzed. And then they gave me an MRI. And it turns out my spinal cord was being compressed and I had like bone on bone, discs completely eroded. So I needed emergency cervical surgery. So, it's like I almost always insist now if I don't get a clear answer from an x-ray, give me an MRI because I know like you're not going to see the soft tissues and everything and you're not going to know the full picture. I mean, you see the bones and that's pretty much it. And like that's not the full story of what's going on. And when something's wrong, you need to figure out, okay, why is this happening? So it's just
Right.
so, so important.
Yeah.
How did he handle his diagnosis when you first got it? How did you handle it?
He handled it a lot better than I did. It was interesting because, I mean, the second we got it was right around, the holidays when this MRI came back, and then he went into, like, research mode. We're calling people. We called pretty much everyone we knew who was an orthopedic surgeon from medical school, from residency, from any time, and said, who's the guy? Who's the
Right,
person that we need to see for this?" And in the meantime, our orthopedic surgeon who does not treat chondrosarcomas, um, had referred us to a community, physician who got Dan in right away and said, "Let's get you a biopsy."
yeah.
So, that was cooking, and it took us quite a while to get the biopsy results because they had sent it out, to Florida, I think, to just make sure that, it was the correct
And that
diagnosis.
waiting is agonizing. Like, it's
Agonizing.
just, I
Yeah.
mean,
It was a little over 2
checking the
weeks.
portal, checking the portal, it's
Yeah.
like, yeah.
Yeah, it was agonizing,
Ugh,
and Dan's dad was a radiologist, and like I said, it was during the holidays, and so we had a trip planned to go see his family, and, then there was, "Do we go? Do we not go?" And then we're like, "Well, we're gonna go go because 'cause we're just waiting."
right.
And,
Yeah.
Dan's dad looked at the scans, and he was like, "Well, maybe it's not. Maybe," and then, of course, you get this little bit of hope.
Yeah.
Maybe it isn't, but, I mean, it obviously came back as a
Right.
chondrosarcoma,
No one
but
wants to believe
right.
the reality of it.
Right.
Yeah, which understandably.
Yep. But we were in like full mode calling people. I was on one phone, he was on the other. I was on with insurance, he was on with this. I was doing this. Is this person on the plan? Is this, we were
Mm,
just, I had a notebook and he was just very task driven.
right.
Um,
Right. Very logical. Like you said,
very
yeah, he's
logical for
the
that.
logical one. Yeah.
Um, yeah. And he just, I honestly feel like, and looking back, um, he handled his illness the whole time with incredible grace
Mm,
and never complained other than like this hurt, you know what I mean? But like never the why me. Um and just I think in some ways was just trying to protect me and the kids. Um
sure.
uh Looking back because he really never showed
Mm,
any of the woe is me.
yeah.
Yeah.
Unbelievable.
Yeah.
Wow. Strong
Yeah, and he
guy.
knew, like he said, I remember when we told the kids, he's like, This is probably gonna kill me, but I'm gonna do everything
He
I
said that to the
can."
kids?
He said it to the kids.
What was that conversation like?
Bad.
I mean, my
Yeah,
gosh.
I mean, yeah, it
Yeah.
was pretty rough.
Yeah.
Um, and I mean, his prognosis changed drastically too. So, I mean, at that point, we were told he had like a grade 2 to 3 chondrosarcoma. It's like, well, 70% 5-year survival.
Okay.
Only treatment really is surgery. And we had this week of tests that, did it spread anywhere? And like they
Mm,
found all this incidental stuff. Like they found something in his esophagus, and then you're like, oh my gosh, it's there. And you're freaking out. And then they go in and they're like, nope, that's not it. That's not cancer.
mm,
That's something else.
yeah.
Then they found something else, and they investigate that. Nope. And so then we're like, "Oh, well, maybe this didn't spread anywhere."
Right.
And they were like, "Nope, PET scan looks good." Like, so
Mm. Wow.
so then you're like, "Okay, well, maybe they can cut this thing out and
Go
we
on with
we might
life.
be good."
Right.
Right?
Right.
And it was a major, major surgery,
Mm.
because it was in his pelvic bone. So they had to cut off half of his pelvic bone. Yeah. And so when you mentioned, like, losing the ability to walk, and
Yeah.
yep, I mean, he had to learn how to walk again.
Ugh.
And there was a question of whether he would be able to.
Mm.
And his instincts, a lot of times, you can result with amputations with this tumor.
Wow.
Just, and he's like, well, if I lose my leg, I lose my leg. I still have my brain. And I
Right.
feel like my brain is good and is gonna, I'll be fine.
Yeah.
So he always had a good, I don't know if good's right the word, but a very
An
healthy
optimistic outlook. Yeah.
outlook. Yes. But after he had his surgery and she came out, she's like, I got it all. Like, I got great margins. We were like, oh, well,
Mm.
maybe we can do this. And then
Spark
we
of
get
hope.
a spark of hope, and then you get the
Mhm.
pathology back, and she's like, well, you have some of these really bad cells on there. So you have
Ugh.
these really, really aggressive cells. So now prognosis went from 70% 5 year survival to 20. So I mean, we knew that's when we kind of knew, like, yeah, this isn't good.
Yeah. Oh boy, that's a real slap in the face. Oh my gosh.
Yeah.
Punch in the gut. Yeah. Oh yeah,
Yeah.
yeah. We started off the conversation by talking about the catastrophe that the health insurance industry is, and
Yeah.
I want to like, can you share what Dan went through with that whole process? I know there were several different
Yes.
blocks.
We
Yeah.
had a lot of roadblocks with insurance. I mean, the first was not necessarily just denials, but just that claims were being processed out of network when they weren't. And anybody that you would call and talk to really wasn't able to help you. And so Dan, recovering from a major surgery, is spending hours on the phone going through line by line of, he was hospitalized for 6 days after that surgery. So there's hundreds of claims,
Mm.
right? Every band-aid is claim in
I
the
know.
hospital,
I
right?
know. They'll nickel
Um,
and dime you for everything.
and line by line, and they just can't figure it out. And then you call back and you get somebody else. And then finally we found somebody who was like, oh my gosh, like, you guys should not be having to do this. This is our
Right.
job. And so she was finally able to help us. And then as claims came through, still processed incorrectly, we
Mm.
would email her. We had her direct email. And so she was a lovely, lovely woman that helped us.
Mhm.
But the the real thing that started happening were the denials, and this wasn't new to us. Our son had, still has some knee issues, and
Mm.
he's had now 6 knee surgeries.
Wow. Oh my
Yeah,
gosh.
yeah. But few years prior to Dan's diagnosis, he had a major surgery, and we had gone to, Vail, to the Stedman Clinic, which is a world-renowned, orthopedic clinic. And he had one of his surgeries there because he had one here and it failed.
Mm.
And then we found out he had the same problem in the other knee, had the surgery, failed. Oh, and then our orthopedic surgeon's like, yeah, this is an even bigger issue. I'm gonna send you out. So we wound up going to Vail.
Right.
And anyway, so he gets authorization for the surgery, has the surgery, and then the insurance company denies the surgery after the fact,
Oh my god.
which was just maddening.
That's insane.
And we couldn't get through to anybody
Ugh.
anywhere, and only because Dan, has an administrative role in his practice, he happened to know somebody who knew somebody, and at the time we were with Aetna,
Mhm.
high up in Aetna, and he was able to look into the case, and he's like, "Well, yeah, that never should have happened." And we're
Right.
like,
Right.
"Right." And so he was able to fix it.
Yeah.
But what about everybody else who doesn't happen to know someone who knows someone? Like, what are they
Exactly.
supposed to do? So that kind of sparked an interest, and Dan's like, "Yeah, we're gonna do something about that." And then just life happens and you get
Sure.
busy, and he had a busy job anyway.
And he's busy being super dad also. I
Oh,
mean, it's amazing that, he was
right.
such a busy doctor. I mean, I know how busy his practice was. I think I actually
He was pretty
one
busy.
time I had like an urgent situation and that's why I think I switched because I couldn't get in with him soon enough. So I wound up seeing somebody else within the same practice.
Yeah.
But yeah, and then the fact that he was able to balance that with his, home life and
Yeah,
be
plus
such a great dad is incredible.
his administrative role too took up a lot of his time. He was very
Yeah.
busy.
Yes.
Um, so that kind of got in the way, but he was thinking, like I mentioned, he kind of wanted to be a fixer to come in, and so he wanted to, I don't know, increase his education. So at the time he was thinking about like, do I get an MBA or what do I do? And he was meeting with some people to talk to them about that. And that was just kind of in the back of his head
Right.
anyway. Um, so then in Dan's case, he started getting denials. He had a first thing that was denied was a CT scan right before she wanted a CT scan the day before the surgery because we had to wait 6 weeks from his diagnosis to the surgery because they had to make a 3D printed half a pelvis
Wow.
out of titanium. And so that took 6 weeks. So and it actually took seven, but
Crazy.
so then she's like, well, I need to get scans again because it's been
Yeah,
7 weeks.
sure.
So the day before the surgery, which was um, right after President's Day,
Mhm.
um, we go into the Mayo to get the CT scan and they call us into the business office and they're like, they're not approved. So you're gonna have to sign a waiver that if they don't pay, you will.
Ugh,
And the price is 5,500 per scan. So $11,000, which
unbelievable.
we both know it's like, well, if we just go to Smile, we could probably get it done for
Get it out of
$400.
pocket cheaper.
Yeah.
Exactly,
But it
right.
has to be at the Mayo Clinic because that's where the surgery
Ah,
is and da da da. And so
yeah,
we're like, well, why were these not approved? And why hasn't it, when did authorization go through? Whatever. And there was this whole back and forth. We signed it. And
right.
then we had an appointment. We went upstairs and the PA that was working with our surgeon was like, I'm gonna get on the phone with them. And she wound up getting it approved.
Yeah.
Um, which was good. But then, I mean, that was the first of many, and then it was a PET scan that didn't get approved, and then it was chemo, and then it was radiation, and then it was chemo again, and I mean, it was everything,
I mean, and
everything
what did
along the way.
what did they say to you when you asked, "Why isn't this" I mean, you've got this diagnosis that's pretty dire,
Yeah,
and these are the obvious courses of treatment that are being recommended by doctors in that are, professionals and experts in this area. So what
correct.
what did
Well, most of them were based on not medically indicated, because he did have a rare disease, and guidelines really didn't exist for what treatment is appropriate. I mean, there's
Right.
just very cursory, and also because I mentioned he had those really rare cells that put him into a different category. It's treated differently.
Right. Okay.
And most people, especially when you have a physician who is reviewing your oncologist, that's a GI doctor or a
That's
pediatrician,
insane.
has no idea.
Right.
They
It's
have no understanding of how to
right.
treat this.
Makes no sense.
They deny.
Yeah.
I mean, they denied everything. They denied, like, after chemo, they want to give him a shot to boost his white cells. Well, you need prior auth. That's going to take 72 hours. Well, in 72 hours, he's either going to be in the hospital or he's going to be fine. We don't know which. And you're going to
It's
take that
terrible.
risk. Like,
It's
no,
terrible.
they should be able to give that drug based on his blood count that they check in their office right then and there
Of
and
course.
decide,
Of course.
but yeah,
Yeah.
it was just
It's
everything.
so inhumane.
Yeah.
The whole thing just oh, it just it's sickening and maddening and sad and
Yeah.
all the things at once. It's just it's horrible. I'm really sorry you guys had to go through that. I
Yeah.
mean, it's enough when you're dealing with your loved one being so sick and and poor Dan is going through all these treatments and he probably felt like hell and then on top of it he's got to deal with all this red
Yeah. He
tape
had to
and
fight,
it's
fight, fight, fight.
yeah, I
Yeah.
mean all you want to do is spend time with your family and focus on your health and to have to deal with all this on top of it is
Yeah.
just absolutely sickening that he had to, spend his last what was his last couple of years dealing with all this stuff.
Yeah.
He had all those denials. How did he respond? What did he do?
Well, a couple of things. One was after he had his surgery, he was like, "Well, I don't know if I'm ever going to be able to practice again because I don't know if I'm going to be able to walk, and I'm a surgeon, and I need to be able to sit and stand and move." And so he's like, not one to sit idle. So he decided, you know what, I'm going to go to law school and I'm going to fight this prior auth. And he's like, "So I think I'll just take the LSAT." Of course, me and the kids were like,
Right. Go for a walk and take the LSAT,
I was like, "I'll
just
just take it."
a walk in the park.
Yeah, and so
Right.
he took it and he did pretty well. And so
No
then he's
surprise.
like applied to one law school,
Mhm.
and it was a hybrid law school, which was what we needed because it was mostly virtual and it required 4 times a year to go to New Hampshire of all places because it was
Mhm.
University of New Hampshire. And he's like, I don't know why or how he found the school and decided this is the one, but he's like, I'm applying to this one school and we'll see. And he got in and they offered him a scholarship.
Wow.
And he was like, "I think that's kind of a sign." And I'm like, "I think it is." And truly in his head, he's like, "Do I go to law school? Like, what if I don't have a lot of time left? Am I really gonna spend my time like there was a little bit of that
Sure.
kind of pull, like, is this the right decision? And I think for him, I think it was the right decision. I think he needed to keep his brain active.
Gave him something else to focus on too.
Yeah. So that
Mhm.
was that was kind of the bigger picture of what he did uh, you know, in the real life thing that he did. I guess, his oncologist had said to him, one of his oncologists had said, you need to talk to your HR department because I'm getting reviewed. My peer review calls are with like a GI doctor, and this just is not appropriate. And again, because of Dan's administrative role, he had a relationship with his HR and benefits group, and they put him in touch with the medical director. And he, instead of just saying, "Hey, you got to back off and like stop doing this," he said, I want to have a meeting with you." And he did a whole presentation like, "How can I help you make this better? Like this should not be happening." And the medical director was like, "Okay, well, how about we assign you a clinical care coordinator to help you, and then you can help us by meeting with this other medical director. I'll put you in touch with him and whatever." And so I think again, very task oriented. He just
Right.
seemed to focus on what can I do, what can I do, what can I do, and that's how he
Incredible.
dealt with the adversity. I think that
It's
we
incredible he was able to focus on anything,
yeah,
given everything he was going, and people talk about when they go through chemo brain.
yeah.
I mean, and just the brain fog from the stress of, everything that you're dealing with emotionally, and I just can't, I mean, really exceptional that he was able to do all of that under those circumstances is
Yeah, it is looking back too. I mean, he did like he was one like he was researching his diagnosis like crazy, and I couldn't. Like it just caused me too much anxiety. Like
yeah. Yeah.
I couldn't read the statistics. I knew
Mhm.
them, but I couldn't
Yeah.
read them. I couldn't read about and he's like, "You don't read. I need to read." Like we just process differently
Sure.
and do things
Sure.
differently. But yeah, I think that just helped him was just knowledge, knowledge, knowledge
Mhm.
and
Yeah. Yeah,
doing something.
for sure.
Yeah.
So I know one of his missions obviously was to help reform insurance, which was entirely selfless on his part given his circumstance and knowing that, you know, this is only going to help him so much, but he really wanted to help anyone who came after him to not have to go through this agonizing experience. So, what like what were his goals for that reform and kind of what steps had he taken to make those kinds of changes?
Yeah, so, I mean, trying to reform insurance is a behemoth, right?
Yes, it certainly is.
So
Yeah.
he I guess he and I would talk about it, and he's like, "We gotta narrow it down, we gotta have a focus." So, ultimately, what he decided his goal was to bring transparency and accountability to the insurance company physicians who are denying and delaying care as chosen by the patient's physician, right? So he was like, let's focus on that because if we try to reform insurance altogether, I mean, we're going to get nowhere.
Right.
So he had read an article that Ron Howergan, which is the gentleman that does the Flatlining podcast,
Mhm.
was quoted in. And he reached out to him and said, "Hey, I would like to have a meeting with you." And so they set up a meeting, and it just so happened that we were in California, and Dan was on a clinical trial in California, so we were back and forth, and then we found out, like, clinical trial's not working, and one of his lung metastases, like, tripled in size quickly, and so the oncologist was very concerned, and he wanted to put him on chemo right away, and so we wound up getting stuck in LA for 3 weeks, and during that, he had had chemo, and then we got the port out. He wanted it out. He's like, "I want it out. Can I get it out?" And they said, "Yep, you could get." So he had it out. Well, now he needed it back.
Mm.
So we were at the Cedars-Sinai Hospital, and he's like, "I got this meeting with this guy." It, like, ran longer
Oh
than
my
normal, and
gosh.
he's in recovery. And so he starts this call with him, and he's like, "Where are you?" And he's like, "Oh, I'm just in the hospital getting, treatment, whatever." And
This is right after his port surgery?
yeah, so,
Oh
like,
my
we're waiting
gosh.
for transport to come take us to the
Wow.
car, right? So
Uh-huh.
he transport's pushing him, and I'm, like, really quiet, bringing the car around and driving, and then we were in LA, and I couldn't have, like, navigation on or anything because he was on this important call.
Right.
So I was just, like, driving around
Oh
aimlessly
my
while he was
gosh.
talking, and anyway, apparently that really struck a chord with Ron. Was like, "Oh my gosh, like, this guy is, like, literally in the hospital, and he's worried about everybody else."
Ugh,
And that was Dan, he's
yeah.
worried about everybody else and wants to make things better for everybody else, and he might not even be here to see the
Mm.
fruits of his labor. So Ron really, um, was taken by that, and so he put Dan in contact with, Wendell Potter, who is a ex-Cigna executive who turned whistleblower.
Ooh,
Really amazing man, and a
interesting.
very, very nice man. And he set up multiple meetings with Dan and some attorneys, where they were starting to get together and trying to figure out how best to um move forward with
Yeah.
his plan. They didn't get super far, but um couple of people, journalists and stuff were interested too. And so, they wrote a few articles about him
Yeah.
and
Yeah, I'll
yeah,
try
stuff like
to,
that.
I'll link to those in the show
Yeah.
notes.
Yeah. So that's kind of how that all started, how he kind of turned advocate that, was more visible, I guess.
Right. Right. It's amazing. I'm curious to know, I mean, there's been a lot of stuff in recent news with the whole shooting of the United Healthcare CEO. That was a like my obsession for several weeks, like a lot of people were, but when I get focused on something and passionate about something, I kind of,
Yeah.
yeah, hyper focus, and I was taking in every piece of information about it. I'm sure it must have hit an entirely different chord for you, given everything that you guys were working on and going through and all that. Um, what are your feelings about that whole situation?
Well, it's interesting. I mean, well, first of all, I don't think anybody deserved to be murdered.
Right.
So I'm just gonna come right out and say that right now.
Yes.
Um,
Agreed.
he didn't deserve that. He may not have been a good guy,
Yeah.
but he definitely didn't deserve that. And I was mostly struck by, the lack of empathy and comments and stuff like that. But on the other side, I'm like, look, I hate insurance companies probably as much as anybody else.
Yeah.
And um I my initial thought was, well, let's hear what the story is behind this because something bad happened to this guy's family, right? I mean, this is
Mhm.
a smart, educated
Oh, yeah.
young man,
Yeah,
right?
I think Ivy League. Uh-huh.
Yeah. So I'm like, and then with the bullet casings with, deny,
Deny,
delay, depose.
depose. Yeah, I think that was the
Yeah,
3.
it's like,
Uh-huh.
oh no, this is well planned out.
Oh,
And
yes.
I still think there's more to the story with that we don't know yet. Having said that, in one way, I'm like, well, maybe it's bringing this to light. Like, there does need to be a big educational blast for people because not everybody is aware that this is happening every day, all day to everyone.
Yes.
Um, but murdering the CEO is I mean, they're just going to put another guy in there. I mean, it's not going to change
Yeah,
anything,
it's not gonna
unfortunately.
change.
It's not. And not that that would ever be the way to make the change
Of course
anyway,
not.
but
No. And you know, it's funny. There's people that are very close to me that say, you know what, good. I'm glad because you know, do it to another CEO, maybe we'll get some change. And I I don't know. I guess I'm just more of like a peaceful rule following type of person, I suppose. I don't know. You know, and I know people I don't I want to be careful because I get it. Like I understand the anger, I understand the frustration, and I too have dealt with many situations in, you know, the with doctors, with insurance, with everything, with my diagnosis and not getting a proper diagnosis for 45 years and, you know, so many things. So I don't want people to think that I'm not empathetic to the situation. I am
absolutely.
extraordinarily empathetic to it. I think it's a very, very broken system that desperately needs reform. And I think that what you and Dan were doing was a beautiful effort, amazing, and it's something that is so, so needed. Um, I don't believe in murdering people.
No.
It's just not. I don't think it's an effective way to make change. I think it's very commendable that Dan was going to such lengths to get a law degree and do all the research and really like try to at the root of things get to how do we make a systematic change. You know,
Yeah.
that's more the way I would approach it as well.
Yeah, and it is an uphill battle, and it
It
probably
is.
requires some legislation, and for us, I'm like, "Gosh, this is just it's so simple to achieve what Dan wanted, but it just won't happen easily," is like, if we could get legislation that says that the act of signing a denial
Hmm.
is considered to be practicing medicine,
Right.
that would and I don't know if people know this, but the doctors that work for insurance companies, they must be licensed,
Hmm.
okay? Um, and now they must be licensed in the state in which the patient resides. So many of these medical directors have licenses in 8, 9, 10 states, whatever it is, right?
Yep. Hmm.
However, they are not held liable. It's not considered
It's not
practicing
okay.
medicine, right? So they can deny all they want. And if there's a bad outcome, well, there's no accountability
Right.
at all.
Right, which
Nope,
makes it
sorry.
that much easier for them to deny. I mean, there needs to be the ability
Right.
to, you know, have malpractice suits at the very least, and you know, at the very most, a lot more repercussions. I mean, even criminal repercussions, because it really is indirectly kind of murdering people and psychologically torturing people by, you know, by withholding these things.
Exactly. And, you know, recently within the last 2 years, there was a class action lawsuit brought against Cigna for denying like 300,000 claims in a month. So they're not even looking at your chart. This is AI denials. So
Ridiculous.
doctor's not even opening the chart, looking at it. It's just deny, 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 deny. Well, if they can be sued for it because they're now medically liable, maybe they'll take a second look. It's not the answer, but it's a simple step that could be taken that doesn't cost any money,
Right.
that might help.
Right, cause people to pause and think, "Okay, do I wanna do this because it's my ass on the line? If something goes wrong, then I'm accountable." And if that's the case, then they're more likely to hopefully make a more informed decision.
Right.
Yeah.
But unfortunately, it's
It's
not
I know
likely to
it's not
happen.
that
There's other
easy.
laws, these ERISA laws that are in place that are blocking essentially that from happening. So there needs to be found a way to go around that.
Circumvent
And
that, yeah.
yeah, yeah.
Mhm,
So
mhm.
they're very well protected.
Whew, boy, yeah, it's I hope in our lifetimes that we see something change. I mean,
Yeah.
I guess if Luigi did nothing else, he did bring attention to the subject that sorely needs to have attention brought to it. So
Right.
hopefully, I don't know. I mean, hopefully something good comes of it, you
I
know?
know.
I
I
mean,
know. And I
again,
mean,
not the way to go about it. No, no, not condoning this at all and
yeah.
not on like the free Luigi team or anything like that. But you know, I mean, I think he needs to pay for what he did. It's not okay because where does that end, right? Like,
Right.
what do you do that? I mean, like, you just have a license to go around and murder any CEO of a company that you don't agree with? You know,
Exactly. That's the problem.
mayhem.
Unfortunately, everybody's replaceable. They'll just pluck somebody else in their spot. I
Right.
mean,
It's
it's
not
not,
solving a problem.
it's, yeah,
Yeah.
it's not solving the problem. It is bringing light to it. And
Yes.
hopefully hopefully more than has been, and, but other than that, wasn't super effective as far as
No. I mean, I guess we kind of talked about this, but I was going to ask you, like, what are some of Dan's ideas in order to like move the needle forward with this reform? Was there anything specific?
I think just like he said, like honing in and saying, nope, his what his goal was to bring transparency and accountability to the insurance company doctors.
Yeah,
So, um
makes sense.
yeah, because you can't tackle the whole insurance reform
Yeah.
prior auth and even in general. There've been some recent laws that have happened that sound good in theory, but probably aren't necessarily like they're saying like you have to respond to a prior auth in certain states
Yeah.
within 72 hours and you must be in the same specialty. Yeah, you must be in the
I
same
mean, you'd think
specialty.
that would
Like
be obvious,
you
right?
should have to at least treat 3 to 5 a year of a chondrosarcoma in order to review a chondrosarcoma,
Right.
right? Otherwise, I mean, we went and found here at Mayo, we have the local regional expert,
Mm-hmm.
and we found a national expert,
Yeah.
maybe even international expert in California. These 2 are collaborating and they're agreeing on a course,
Mm.
and this family practice doctor or whatever is like, "Oh, no, that's not medically indicated." Well,
Like, how does he know? He's not the person to make that decision. He hasn't.
right. So then it's like, and Dan's idea went a little bit further in that when you as a physician want to contract with an insurance company, so for example, let's use United Healthcare. I want to be a physician that takes United Healthcare.
Yeah.
Well, they vet you. And if you have something on your record, like let's just use a DUI. I have a DUI on my record. They could say, nope, we're
Mm.
not
Too much
contracting with you.
liability.
Too much liability. We're not. So they vet you, right? They also grade you. Like
Hmm.
they grade you on quality, they grade you on cost, whatever. So I'm like, so his idea, and I agree with him, is they've already vetted you.
Right.
So why can't this national expert in oncology and in sarcomas be able to order the tests that he thinks his
That are
patient
indicated.
needs,
Right.
And
Sure.
especially with when when you're talking about rare diseases and chronic diseases, it's more of a niche thing, but
Yes.
um not everybody's an expert. Not everybody knows what is indicated. And sometimes it's not within a guideline. And you have to go outside the guidelines.
Yeah.
And, insurance
Every case
companies,
is different. Every
every case is
person
different.
is different. Every medical situation is different. There's like all these, there's like a constellation of things going on in a human body that need to be taken into account.
Right.
So, yeah.
And I mean, so the answer is, well, there is no treatment for your so I'm just supposed to sit here and die? You're not going to try anything? You're not going to let me where this guy's recommending,
Right.
that I try this.
Yeah.
You have to try,
Of course. Of course.
and they hide behind, well, we're not saying you can't have treatment. We're just saying we're not going to pay for it. Well, when it comes to
I mean,
chronic diseases and cancer, you cannot outrun the bills. Like
no,
you could pay for a scan here or there, but you're getting scans regularly, as you know.
very
You're
expensive.
getting chemo or infusions or whatever it is regularly.
Hmm.
And
And the out-of-pocket cost is absolutely
you
astronomical.
can't.
Yeah.
So essentially, by denying care, you're saying, yeah, you can't get it.
Right. No, and
You
and
are.
and you guys, and here you are, an affluent family. I mean, two doctors, two incomes of two doctors, and then you've got, people that are just barely getting by. I
Right.
mean, if you
Right.
guys can't do it, how are people,
Well,
everyday people that are just living on like a
right.
bare bones salary supposed to do it? And then you've got people like myself, I'm on disability. I'm on a very limited income. And fortunately, I do have, family and my fiance that helps out a little bit, but not, I mean, not as much as I sometimes need, it's
Right.
so it really backs you in a corner, and sometimes you have to make decisions about, okay, well, am I gonna have to like, I've had to give up taking certain medications. I was on a specialty medication that stopped being covered, and it was like $3,000 a month, and I'm like, "Well, looks like I can't take that medicine anymore. I guess I'm just gonna have to, like, be extraordinarily dizzy and possibly pass out, because I can't take this medicine." I
Right.
mean, it's just it's such an inhumane decision to have to make, and then, you were talking about, I was thinking about, they have these doctors that are evaluating the claims, and they don't have experience with that particular, very rare condition. And, as someone with, a rare-ish condition, it's not as rare as people think. It's just less rarely diagnosed and not
Yeah.
as well medically known and known in the medical community. So,
Yeah.
I have all sorts of orthopedic issues. So like I go to a shoulder doctor, and he's like, "Well, can you do this trick where you bend your thumb all the way to your wrist? And if not, then, well, are you sure you have this?" And I'm like, "Yes, I'm 100% sure. I've Do you want the list of surgeries I've had because of it, and the list of symptoms, and the list of diagnoses?" And they don't,
Because they don't
because
treat it
no,
very
they're
often.
an expert in the area, but so now I'll go to my doctor that treats me for my Ehlers-Danlos syndrome and ask specifically for referrals to orthopedic people that like know a little bit more about Ehlers-Danlos, so that they're not so dismissive, or else
Right.
they're just kind of like, "Oh, you're just
And
complaining a lot."
to be honest, if you're a doctor in practice and you don't know that much about it, that's fine. But don't be reviewing an expert and telling them that they can't do
Right.
what they're suggesting. Do you
Yes.
know what I mean?
Yes, absolutely.
That's where I'm like, the disconnect is like, not everybody's going to know everything about every rare
Of
disease.
course,
Like
of course.
when Dan was diagnosed with chondrosarcoma, I was like,
What's that?
think I've heard of that, but I don't, I'm not, I got to look that up. Like,
Yeah,
I don't know what that is.
right.
Because I'm a pediatrician, and guess what? We got reviewed multiple times by a pediatrician. They have no business reviewing that.
Oh my
Trust
gosh.
me.
Yeah, it's not very common, I understand, in people under 40, so
Yeah,
I'm
trust me.
imagining you're not seeing those
There's
cases.
some in their 20s and stuff, but, like, I've
Yeah.
never ever seen it ever. Um, so it's like, if you are reviewing something that you don't know about, perhaps you need to pick up the phone and call up the expert who's
Yes.
recommended it and said, "Hey, I see you recommended this. I don't see this in the guidelines. Can you please tell me why you're ordering this? What's your rationale?"
Right.
That's all it takes.
Instead of making a life-altering
Deny it.
decision based on
Well, yeah, because it's gonna delay it. Then they have to appeal. Then they have to finally do that peer to peer. And guess what? If he's not available when this person wants to, then it has to get rescheduled and it gets bumped down the road. And it's just
ugh,
yeah.
and in the meantime, you've got a disease that's growing inside your husband, and I mean,
Yes.
do you think that had things moved along more quickly, do you think there could have been, I mean, I know it's, like, hard to probably even, like, contemplate that, but
Yeah.
do you think anything could have been different?
I think that we were able to ultimately get or do what we needed to do within a reasonable amount of time, but only because we were lucky in that respect. I hate to say that I was lucky because I don't feel lucky.
Yeah.
But in that respect, because we had a clinical care coordinator who was just a wonderful person and who
Mm,
really cared for Dan.
that's
She's
awesome.
a wonderful lady. I can't say enough
Yeah.
nice things about her. Um, and because of her and her help, and she has no power, she
Right.
can't, she's a nurse,
Right.
but she was able to get it in front of who it needed to be in front of. And for whatever reason, this medical director was in our corner.
Yeah.
And only because I think Dan was like, I want to help you make things better.
Yeah.
Not, hey, you're doing this bad, blah, 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 blah. So
He approached it in a more collaborative way.
I think so. I mean, I actually don't know why he was helpful to us, but
Yeah.
um so I don't think it would have made a difference. Luckily, that is not on my conscience, but I know and he knew that we were fortunate in that respect.
Mhm.
And everyone else isn't, or many people are not.
Right.
Um
For sure.
and I didn't mention this, but I mean, obviously Dan wouldn't know about this, but Dan got chemo shortly before he passed away. He got chemo in May and June, and he passed away in August. And this chemo was denied, of course. Um, but then it was approved. So we
Okay.
got it turned around, we got it approved. And it was at Mayo, and Mayo won't ever give you anything without approval. Like they'll
Mm,
make you come in and sign, right?
wow.
But they got the approval, they had the approval. He got the chemo, and then in August, literally it was dated the day Dan died. So I got it
Ugh,
a week later maybe. It was overturned. So it was like medical director with Evacor, who's like a third party that Blue Cross and other companies contract with
mhm.
to deny their care, right?
Unreal.
This oncologist decided, like, he knew he got it. He knew he got the chemo,
Yeah.
decided it wasn't medically indicated, and rejected the claim. Is $80,000. Yeah. And I was like, "Oh, that's just a huge slap in the face," like, right
Oh, God,
after,
yeah.
literally I got it probably a week after Dan died because it was dated
Ugh,
August 3rd, which was the day he died. So clearly he didn't know he had died, but that does it's
yeah,
irrelevant.
right. Oh,
But,
the pain of it all.
yeah,
It's
and I
just,
was able
like,
to
horrible.
get it paid because of Becky, our clinical care coordinator,
Yeah,
was
thank
like,
God for Becky, right?
we're gonna" he took it to the medical director who had approved it first, and he's like, "Yeah, like, we're paying this." But it was an ordeal, and it took a while to get
Yeah.
taken care of, so it was very stressful.
Oh my
And I'm
gosh.
like,
Yeah. Can't imagine.
again, and I had a feeling we would get it taken care of, so I wasn't really super stressed about the $80,000, so I was just devastated and then even more devastated when I
Right, like,
got that.
money is the last thing you're thinking. I mean, it's
Yeah,
like it's a
yeah,
goes to the back of the list when you're dealing with life or death.
yeah. But what if you didn't have Becky to call? Like, what would you do?
Right. Right. Well, people go into tons of medical debt, you know? I mean,
Yeah, like,
it's crippling medical debt. I've been there. It's like,
I know.
it's just crazy. It's
Yeah,
not fair and it's not right.
agree.
So, Tracy, if other people want to, like, I mean, I think there's probably a lot of people out there that feel just as passionate as you and I do about this. What is there anything that they can do to get involved, to help your cause? Because I know this is important, as Dan's legacy to really continue to see this through as much
Yeah.
as you can.
We're still trying to figure out how to how to do this, and I'm trying to was working with an attorney who after October 7th and the whole Israel thing, she became very involved with that. So she got
Yeah,
pulled another direction, totally get it.
sure.
But I think we will probably, when things quiet down, get back together
Good.
and try to move forward with that. Um I'm trying to in other ways. I'm a part of the medical society here, and I'm on the advocacy and legislative committee. And so one of our goals hopefully this year is to work on prior auth reform. So
Good.
trying to get in that way. Um Plus I've gotten very involved with the Chondrosarcoma Foundation, and they established an endowment fund in Dan's name, which is to help patients with chondrosarcoma who are experiencing denials and help them try to navigate through as much as we can or are able.
That's incredible. No, I did see that, and there's I think a link on the website to kind of a list of things you can do if you're found in that situation.
Yes, Dan and I wrote that article actually. Yeah,
Ah,
so Dan wrote that
okay. But there's
article.
also a presentation, I think, right? Isn't there? I think there was a link to, like, I don't know. I feel like there was something in there that
I'm
I don't
not
know.
sure. I'm not
Yeah,
sure.
it was kind of like a step by step
Yeah, and
thing.
so I've yes, I've tried to find ways. I think to answer your question at the beginning of the podcast was like, how do you deal with this? Is like I have to find a purpose.
Right.
And I don't know how to do that right now.
Mhm.
And when you lose a spouse and your best friend and the center of your universe, essentially everything changes, from how you eat dinner to, well, my job changed because I had to stop working to help Dan, and then my practice closed. It's a long story.
Right.
So I'm starting from the beginning here. I'm
Mm.
trying to rebuild a life here that, you know, is hard to want to do. Um,
Yeah.
but, my kind of mantra that I'm telling myself lately is, you know what, if a door opens, I need to at least look through it. Like my inclination would always be just to say no.
Right.
Um just
Yeah.
to say no and isolate myself but
Mhm.
I'm really
Common
trying.
strategy when you're dealing with as much as you're deling with.
Yeah.
Yeah.
And so I'm like, if door opens, I gotta at least peek through. So um I've been getting more involved. I got brought on as the executive director of the Chondrosarcoma Foundation, and I'm
Nice.
helping them start a tumor board, which will help patients who are maybe not in sarcoma centers. There's sarcoma centers across the country, but not everybody has access to them,
Right.
where they can bring their cases, and we will have some experts on a board that will review their case and
Mm.
give suggestions to their oncologist about treatment, or maybe even just validate treatment
Great.
that their oncologist can do. So I feel like I'm trying to help in that way as well.
Oh, that's very meaningful.
But what people can do is, I think, talking to legislators in their area about prior authorization reform
Mhm.
would be very helpful. Trying to meet with them or writing them a letter um, would be helpful. Other than that, I mean, certainly once I get something, if I can, figured out or established, I probably will need help at that point. But
Right.
until then, it's like, no, we're still trying to figure out how to move forward.
Sure.
Yeah.
Sure. Yep. I did ask you to print out a letter that Dan had written to, I believe it was one of the doctors that denied him.
Yes.
And it's a very long letter, so I don't want to read the whole thing because, I was one of those kids in school. Whenever I got asked to read, I got like nervous and I lose my place and
Yeah.
everything. But
Yeah.
but I do feel like, I don't know, I just kind of want to maybe read like a couple of paragraphs from the beginning and a couple of paragraphs from the end, just to kind of let people know where Dan was coming from and what he was trying to accomplish. And like, I think the way, what struck me definitely as I was reading some of this is that he approached it from a very collaborative standpoint and a very calm, cool, and collected,
Yeah.
where it's such an emotionally driven situation. And yet he did it in a very like, let's work together and I want to make change, and not like, you suck because you denied this and you put me through hell. I mean, where a lot of people would you know have a lot of expletives in a letter like
Yeah.
this.
It's funny. That reminds me, I'll digress for just a second
No,
and then I'll
no
let you go.
worries. Yeah, go ahead.
So I drafted a letter. It took me a long time to figure out who overturned that chemo at the end.
Yeah.
So I drafted a letter to this person. I
Mhm.
just don't know how to find him, but um and my letter is not
Not as
it's like,
kind.
how do you sleep
I
at
don't blame
night? And
you. I
like,
mean,
yeah, it's like,
I think
I
that
hope you never have a family member that's sick and that
Mhm.
someone like you is reviewing your case, like,
Yeah.
yeah. It is funny
Yeah.
to
I
see
mean, it's
the
very personal.
yeah.
I mean, and I've heard you say also you're more of like an anxiety type person, and
Yeah.
you're looking at her.
Yeah.
Same,
Yeah.
and we're very like passionate and emotional. Everyone's different the way they deal with things, but I am also like very, I consider myself to be very kind and loving and all those things, but I'm also very like passionate when someone, when I get something gets me, I'm like,
Yeah.
like I can
Yeah.
get a little fierce, for sure.
Yeah.
So, God bless you, Dan. I mean, I mean, you really held it together in a tough situation.
Yeah.
Gosh, do you feel like he's with you still in a way? I mean, everyone's got different beliefs about that kind of stuff,
Yeah,
and
and honestly, those have all been called into question for me. Like, I don't know
yeah,
what I believe anymore, so
right.
that's
Yeah.
confusing. Um, I don't know. I mean, there's definitely times where I'm like, okay, this is what Dan would say. So is he like with me telling me that, or is
Right.
it just me thinking of, what he would say because there's a lot of times where I'm like, what would he do? Um, and then there's times where I'm like, gosh, I don't know what he would do. And then I panic because I
Mm,
don't know what
right.
he would say. And then I would ask the kids, well, what would dad say? What would dad do?
Mm, yeah.
And sometimes they don't know, and then we're like,
Right. Yeah.
but
Yeah. Yeah, but I mean, when spent 25 years, well, plus 25 years married, but then you were with him
yeah,
for what,
five,
4 or 5 years before
five,
that? Yeah, so like
so
30
30
years.
years.
And yeah, it's like you're like another part of your brain, I mean, it's
Yeah. And I'm, if I was one to believe that like, yes, they can be with you, I mean, he would be. Like
of
there's
course.
there's no question. I mean, we
Yeah.
were we were a team, and there's no question in my mind, but whether or not that happens, I don't know anymore.
Yeah, no, I mean, it
Yeah.
makes sense that you would question everything
Yeah.
given everything you've been through. It's completely understandable.
Yeah.
It is. I go back and forth with that whole like woo woo kind of stuff also, but
Yeah.
I definitely have had some experiences in my life where I feel like, people are still with me or like, my uncle passed away a few years ago and, I saw like a cardinal, and this I kept seeing it and I was like, that's got to be him like sending me a message, and I think, it's like, okay, is it real or are we telling ourselves those things to make ourselves feel better? Who knows? It's just again, I
Right.
I go back and forth. Sometimes I think, sometimes we're better off just believing in the things that make us feel better as long as there's no harm to anybody else. Then
Totally agree with that.
yeah,
It's
sometimes
yeah.
it can help, if it helps you emotionally, it's not harming anyone else, then go for it.
Yeah, and I do think that in Dan's case, Dan had a lot of faith. He was very religious,
Mhm.
and I do think that that helped him um just, face his mortality and everything else in a way that, I don't have. I don't have that kind of
Right.
faith, and it's even less now
Yeah.
than it was, but
Yeah,
I do
sure.
feel like no, that helped him.
Mhm. It
It
does.
really
I think a
did.
lot of people turn to that. People have different ways of coping. I mean, for me, it's like a lot of like being in nature and going to the gym and, hiking and things like that that really kind of get me in touch with my emotions and kind of give me that like cleanse that I need to get through some difficult times, and it's also doing things like this, like just having very open, honest conversations, I think is really, really helpful and therapeutic too, you
Yeah.
know, and just being like real and authentic about the things that so many of us go through, but not everybody talks about because they don't want to make people uncomfortable and they feel uncomfortable themselves talking about it. But I think when you do share your story, it heals a little bit each time, it really does. So, and I think by sharing your story, you're going to help other people to heal a little bit. So thank you for doing that. I really appreciate it.
Oh, thank you. My biggest fear was that people will forget Dan,
Right.
and anything that I can do that, allows me to talk about him and allows other people to know who he was helps me.
Keeps his memory
It
alive.
does.
Yeah,
Yeah.
yeah, which is
Yeah.
huge. Yeah, I mean, he deserves that because he made a big impact on a lot of lives.
Yeah.
Yeah.
He did.
So I don't know. Do I read this or not?
Maybe
Um,
just the first and
yeah.
how he closed it because you're right.
Yeah.
It's very
There's a
measured
lot of
and
meat in between, but yeah, but
yeah, it's
like,
pretty long.
yeah. So, okay. So Dan says, Dear Doctor, I want to make you aware of how you have impacted my life and how you impact the lives of multiple patients who have never chosen to see you as a physician. You affect some of us more than others. The disparity may result from a variety of factors, from our ability to pay out of pocket for denied services, our understanding of the approval process, our support resources, or the amount of time our physicians can find to fight your denial while still leaving time to treat and counsel the patients and families in front of them. My name is Dan. I'm married to Tracy, and we are raising Rachel, Sam, and Sarah, and 3 dogs. I have metastatic dedifferentiated chondrosarcoma. Gosh, I thought I'd rehearsed that enough. That is almost certainly a fatal disease. As an oncologist, you may understand that I relish the time I have left more than someone without my disease. I am a husband, father, physician, and law student who still has a lot to give. Um, and he goes on and on about I think this next paragraph is important. In addition to spending time with my family, I want to bring transparency and accountability to delays caused by medical decision making in the authorization process. This process is put in place by insurance companies and their reviewing doctors. Unfortunately, sometimes the insurance company doctor has less knowledge or experience than the physician ordering the test or treatment. Putting the case in review for this less qualified doctor to add input can add days or weeks to the time it takes to schedule testing or treatment. The following scenario concerns only one CT scan. Since cancer patients may need multiple simultaneous tests and treatments, you can imagine how much the review process can affect the care and timeline of a patient. So, he gets further in depth into his specific situation, lists out a whole bunch of things that occurred. But then in closing, the last couple of paragraphs, he says, this letter is about one CT scan denial. As you know, a cancer patient will have dozens of scans and treatments requiring authorization in a system where those with less expertise are empowered to deny physicians with more expertise. This can amount to weeks, months, or more of cumulative delays in diagnostic or therapeutic care over a fight for survival or eventual death. Can we as humans pretend that cumulative weeks to months of delays in treatment over a cancer course doesn't affect survival and quality of life for our patients, families, and neighbors? Is that time and insurance companies to take without transparency and accountability in decision making? Is that why we as doctors went to medical school? Do you really want to be a part of that denial? I don't know how much time I have left. This is it's heartbreaking. But if I can help even a few patients who don't have a voice from being harmed emotionally or physically by an unethical system, I will have partially succeeded in my goal. I wish you the best in your future. Don't hesitate to reach out to me if I can recruit you to my cause. Sincerely, Dan B. Hurley, MD. Yeah. So,
Yep.
yeah, it's just crazy. All right. I think with that we'll wrap it up.
Yep.
Yeah. Goodness.
Whew.
Again,
Yeah.
thank you, Tracy. I really appreciate you taking the time to do this.
Thank you.
Yeah.